Welcome everybody here to the Midwest today, and so I'm not going to make any jokes about calling it the home of hurling anywhere or anything like that, because I'm a long-suffering Clearman, if anyone knows me, so I'm surrounded by plenty of Limerick people looking forward to doing the 5 in a row. So we'll hopefully keep the powder dry on that one. Guys, we just wanted to talk today a little bit about our own experience with ABF and how it's going in the region. So just quickly kind of run through some of the issues we're going to have a quick chat about today, just how the plan that we've developed is going, what's some of the success factors that we have found and the challenges that we're facing as well in the region. What are some of the kind of, again, I suppose, our own performance in the recent benchmarking, and what are some of the kind of the key drivers in that for us. And also then just maybe have a quick chat about some of the, I suppose, initiatives. I know someone was referenced earlier, and we'll have a quick chat about some of the efficiency measures we're trying out in UL Hospitals Group. So just a little bit, first of all, around UL Hospital Group, for those who are not familiar with it. UL Hospital Group has a staff of about 5,500 staff. It serves a population in the Midwest of about 460,000 people, so we're pushing up on the 500,000 people. It has one Model 4, and we've got there's the 3 Model 2s, and then there's 2 specialist hospitals as well in the region. So University Hospital Limerick would have roughly about 520 beds in hospital. Ennis Nina would be about 50-bed hospitals. There are Model 2s, St. John's 89, if I'm not corrected. And also we have the maternity hospital and Croom Hospital, or specialist hospitals. And Croom's orthopedic hospital. So just in relation to then some of the strategic objectives that we've set out in our own ABF implementation plan. So again, a lot of it is very much aligned to the national plan, and again, it's very much about trying to embed ABF across the group, set out I suppose a governance structure that will help deliver that, and also to basically make it as try and drive a culture of performance measurement using ABF data in management decision making. So if you look at the plan where we're at in terms of, we've set out some of the phasing that we've in terms of delivering such a plan. An important part, the initial aspect of that was the resourcing and training of ABS staff. It's been very challenging, I suppose, and I suppose that's one of the things, that's kind of holding us back a little bit really at the moment, in that, we had, like a lot of the hospital groups, set out staffing resources that would be required to deliver the plan, and unfortunately some of that has got caught up in the moratorium at the moment, and the recruitment pause, and it's made it quite difficult to achieve as much as we'd like to have achieved at this stage. It's I suppose a key piece of the whole delivery is to have that staff that are developing ABF and bringing it to the next stage, moving past the reporting and actually really starting to implement it across the hospital group in terms of the culture and it's part of the decision making process. So again, some of the other parts of the plan, implementing PLC across all hospitals and using the findings of that data. Again, at the moment, a lot of that is probably a bit behind where we'd like to be at the moment. Again, as because of the staffing issues. Phase 3, stakeholder engagement and reporting on the ABF data. So again, we have had some stakeholder analysis where we've done, and we've sat down with various groups, working out, what are the key stakeholders in it and what each party is looking to get from ABF. So again, some work has already been done on that. And activity-based management, ultimately where we really want to get to is, using that data, that valuable source of data in the decision-making process, not just at a senior level, but right across the organisation. So in the Midwest, we set up very early on. We set up a kind of a steering group with an oversight group with 3 working groups. Initially, there was 4. We had one on data governance as well, but that became part of a wider brief across the hospital outside of ABF. So we focused on setting up 3 working groups in UL's hospital group. So we have a very active ABF finance working group, and they've worked very well in developing a lot of the reporting structures around ABF and trying to again bring in our directorate structure into that process. We have ABF Hype governance team who have done really good work in terms of bringing the coding up to the coverage up to a very high level. I think we achieved 99.9% in the last year. So again, we have a very good team there and active in doing that work. And then the ABF Education and Training Working Group, and that was really about trying to, again, this is a lot of us around the engagement piece, working with the clinicians and the broader staffing cohort, working with service managers and so forth to try and bring them in and get them to understand the importance of this. So again, a lot of this work has been going underway for the last 2 years, and we, if you can see here from some of the groups that we've set up, some of the kind of the key members that make up the different groups. So I'll just run past that. Where we're at in terms of UL Hospital Group, we do specialty costing returns for each of the 6 hospitals and patient level costing for UHL and for CRUM, but plans to do more. So some of the success factors that we had, and again, a lot of this work would have occurred over the last year or 2. So we've run activity weeks with, again, just setting up stalls in areas, talking to people, looking at where we can improve, the capturing of activity. In some cases, obviously, it's done very well. In other areas, not so good. Maybe it's done on a spreadsheet, or maybe it's not done at all. So again, it's just working with different areas to try and capture that activity in a more structured way, and looking at where there's opportunities to do that, and again, working with our colleagues in IT to try and develop solutions as well. ABF reporting, again, we've done enhanced ABF reporting. We have a directorate structure across UL Hospitals Group. We don't work traditionally with site managers, so we've one hospital system, if you like, for the last 10 years in UL Hospital Group, and that's based around the directorate structure again. So we kind of realigning then the ABF reporting so that it fits that governance model. And again, then trying to streamline and automate a lot of our ABF specialty costing and PLC, especially as we've seen in the last years, as staffing resources get tighter, it's been quite challenging. So trying to come up with smarter ways of getting the work done. And again, I'm not going to go through every one of them there, but there's been a lot of good improvements made, all incremental, maybe not the big step change that we would like, but as I said, it's based on what we can do at the moment. So I suppose in terms of our own performance over the last couple of years, so looking at 2020, the last time I was on, we had a decrease of $750,000 in terms of funding from ABF. So the more recent one where we've seen an increase of 130,000. So again, what's driven that is we've seen a huge increase in terms of our activity. So maybe we just pop on here in the slide. So just give you a sense of some of the activity that goes through UL hospitals. So we've seen a huge increase in terms of patients coming through the door. Maybe just starting at the bottom left, there are ED presentations, a 12% increase going from, it's one of the, I suppose, well publicized, one of the busiest EDs in the country, with 71,000 back in 2019 going through the door, up to 80,000 last year. And even at that, I think if you look at it over the last 10 years, if you add in the LIUs, we've probably nearly doubled our unscheduled care activity going through UL Hospitals Group. So we see a massive increase in terms of people coming through the doors, and it speaks to a lot to the issues and challenges UL constantly has in terms of the capacity challenges. And we obviously are in the news a lot over the trolleys. and the overcrowding UHL. So thankfully, there's some big investments coming in the way with a 96 bed block due to open in 12 months' time, and and some other bed capacity being added as well across the region. So that'll be huge help, and certainly welcome to everybody working in the hospital group. So again, across all the stats there, you can see inpatient activity is up 24% in that period. Day case activity up 12%, and even outpatients has been a huge increase there as well, and 22% up to from 173,000 up to over 211,000 attendances through outpatient appointments now. So it's as you see, it's quite a significant amount of activity goes through UHL. So again, some of the other factors that have driven our ABF performance over the last few years, and I suppose the improved position. So again, we talked to the capacity. We've seen some additional capacity added to help underpin that extra activity we're seeing. So we have a new 60 bed block that was added during COVID. There has been additional new capacity in terms of outpatients in Ennis and Nina. New theatres opened in Croom, and new beds opened in Croom as well. And as I said, huge plans over the next 2 to 3 years to add additional capacity on the UHL site. We've also seen improved coding coverage. I referenced there a few minutes ago around 99.9% code in 2023. So we've the guys in the hype team have done a great job there in getting to that level. So just to commend them on that. We've seen an increase in terms of the level of complexity in day case and inpatients, and improvements to state. So again, metrics all heading in the right direction, and hopefully will continue that way. I spoke briefly about some of the key challenges, and I suppose that's the ongoing piece really. And again, back to I'll take maybe number 6 there, and the resourcing of ABF and Hive staff. That has really been, I suppose, the most challenging aspect of the whole lot, and really, in terms of driving it forward, it's probably the key success factor. We need to I suppose get some of those posts that were approved last year over the line that are currently caught up in the pause. It's also just, I suppose, in terms of the other factors, in terms of trying to improve things like data quality. I think everybody's challenged with the IT infrastructure, the new organizational structures as well, trying to make sure ABF, the relevance of that with all the change that's happening at the moment between the new org structures, the IFMS structures. So again, just trying to keep focus on ABF over the next few years as well, while we're doing all that. So again, back to the staffing piece, it's key. And we're seeing obviously as well a huge amount of, with the waiting list initiatives, a huge amount of activity in terms of insourcing and outsourcing activity that maybe because of the capacity issues in UHL, are challenging to that, we don't have that capacity. So we would have a large amount of that going on as well at the moment, and that would otherwise, be going through the hospital system. It was mentioned earlier on, I know Lorna's going to do a slide for us in a while on the OPD implementation project. So again, that is a pilot project that has been up and running in UHL for the last couple of months, and there's some really good work going on at the moment in that space to I suppose bring OPD into ABF space. I suppose one of the initial quick bangs we're seeing on it, and in fairness to the great work that's been done by the teams involved, is we're seeing a big cleanup of the data on our IPN system. So immediately the operational side of things is really improved even before we've even started, I suppose, down the ABF journey with it. So I suppose that's the initial findings. That work is still ongoing for the next couple of months, and I'd said I'll leave Lorna to go into it in more detail in her presentation. I suppose just to talk a little bit about some of the initiatives that we've got going on at the moment in UHL again, and with efficiency in mind, and I know productivity is a very keen topic at the moment. So we've had a huge project going on for the last year or two in terms of modernising our healthcare records department. Like a lot of record departments across the country, I'm sure it's very old manual kind of lots of paper, lots of folders, and chasing stuff around the hospital trying to find charts everywhere. So it's been a huge challenge. So we started a project maybe about a year and a half ago to start modernizing the whole healthcare records environment. So the first phase of that was rolled out at the start of this year. So our library has moved offsite to a new modern state-of-the-art library with kind of a robotic storage system, which is working really, really well and gives us a lot of activity stats around the movement of charts. So that's up and running, and we're moving on to the phase 2 of the project now, which is implementing a digital health record. So again, I suppose this is really, it's not an EHR, I suppose, just to say that, but it's maybe the preamble to that, in that we're looking to try and get a smart scanning solution in place that will not just, I suppose, scan the records, but will also, I suppose, allow you to be able to read those and to search on those records. Target at the moment, there's a DPS, I think, and we're working with our colleagues nationally on this in procurement. There's a DPS due to occur in the next month, or in the next couple of months on that, and hopefully we'll be in a position to go live on that in about a year's time, and that will transform really the healthcare records department and how they operate. And a link to that project as well, we're also looking at trying to roll out an RFID project. So again, that will allow us to track our charts around the site, because we spend an inordinate amount of time going around trying to find charts. So again, we're hoping that solution will allow us to track those. And again, with having that infrastructure in place, there's potential for other applications. So maybe even tracking patients around the hospital site, tracking patients in and out of theatres, so forth. So if we can get that infrastructure set up, that will be a very welcome development as well. So again, that's currently rolling ahead, and we'd hope to have that in place towards the end of the year. Just some of the other huge efficiency measures as well that are over the last few years, we've had a blood sciences project, which is seeing a huge automation of our laboratory. So they're dealing with, like a lot of areas, huge deficits of staffing at the moment, and they've seen a huge increase in the volume of testing they're doing, but through the successful rollout of the blood sciences project and the robotics in that department, they've driven a huge amount of activity through that and been able to handle that additional growth. So that's been a huge efficiency measure we've seen across the site. And I know Deirdre mentioned earlier on the good work that's happening at the moment around the virtual wards, and that's due to kick off at the end of June. So again, it's just a sample, really, of just some of the kind of things that are happening on site at the moment, and driving things forward. So that just brings me then, really, just to kind of the acknowledgements, just to into my presentation, just to kind of thank everybody about the opportunity here locally that have kind of been working on rolling out the ABF across the whole hospital group. So again, just some of the key people involved and the key stakeholders. So just to acknowledge them and all the work that has gone on in that space. So that's really it for me. So I just want to thank you for the time today. Thank you.